Today, we bring you to Summerville, where everything will come into focus. We're at MyEyeDr, a brand new location just off of Bacons Bridge Road, to talk to Dr. Paul Salvatore about a pervasive issue plaguing more than 40% of all Americans. So, of course, we're talking about nearsightedness, and Dr. Salvatore, it sounds like we've got these to blame. So tell us a little bit more. There's a more scientific name for nearsightedness.
Yeah, it's really called myopia.
Okay.
But why would we call it that when everybody kind of just says nearsighted, right? So obviously you know that means that the far away, pretty blurry, the up close can seem like it's clear, but you get fooled because it's your optics.
So what causes that? Because I know myself, years ago, I started to develop it. I noticed when I was driving at night, the signs got blurrier, the lights in the distance got blurrier. So what is it exactly that causes that nearsightedness?
Well, it's so easy. It's that the eye is longer than it's supposed to be. And so the length of the eye means that when the light enters the eye, it doesn't focus on the retina. And so if it's focusing before the retina, then that means you're going to have blurry vision and eye strain. And guess what? It happens in childhood as you grow.
It does.
And so you can kind of grow into this stuff, and it can get worse over time. Sometimes it levels out, but honestly, it can progress.
And it's because of these screens. So whether it's a phone or a computer, that also sort of exasperates the whole changing of your eye structure.
It's the screen time, right? Yeah. So the best thing would be to try to give yourself 30-minute intervals on the screen. It's not the screen so much, but it's the focus time, because as we're straining the muscles, as we're looking at the screen, we're converging a lot. We're using our eye muscles longer than they're intended to. And so that can exacerbate the symptoms.
Would you have the same situation if you just read a lot, just out of a straight, book, not looking at a screen?
That's a great question.
Okay.
It's worse on a screen.
It is.
But yes, convergence is the same, right? So a lot of near point reading, however, screens are so prevalent and they trick our brains into thinking we need more, more, more. A book doesn't do that.
No, that is true. And what about the blue light too that comes from the screen? Does that also affect your nearsightedness?
Not so much nearsightedness, but just the overall health of the eye. So blue light can be really associated with things that can go wrong, like macular degeneration. However, not for children, but still the strain that comes with that, that's why we have blue light filters on our glasses these days.
Yes, indeed. So what are some of the symptoms? So if you're starting to realize, like, you know what, I'm not seeing things the way I used to see them, what are some of the other symptoms that people should look out for?
It's basically blur, eye strain, can't focus, you can't do the task for long enough, but it's always blur first.
Okay. Does it also make you tired? Because I know if I'm straining too much for too long, then I do start to get a little bit of brain fatigue.
Well, the tricky part about nearsightedness is it'll fool you into not thinking that, because it's going to be blurry for far away. And like I said, it might seem like it's closer up close, but that's your optics fooling you.
Is there any way to cure it? What are the treatments?
Good question. So there's no cure, but there's a lot of treatments. Obviously, glasses, contacts, that's going to be your main treatments. We can do surgery like LASIK. There's even some drops we can use. And for that matter, there are a few things that we can use to try to prevent some progression.
Yeah, okay. Well, tell us a little bit more about MyEyeDr. So this is a beautiful store that you've just opened here in Summerville. This is a very large company, which I don't think a lot of people realize just how expansive it is. So tell us a little bit about the history.
Yeah, absolutely. So we're over 20 years old now in the field. We cover a lot of states, and in particular in South Carolina, this is our 15th office. So really happy to open this office at Summerville, Bacons Bridge Road. For me, I've been able to watch us grow and open other offices. And in fact, we're going to open another office in Summerville this month up on North Main Street.
Oh, wonderful. All right. So as the regional director, you oversee a lot of stores. But what sets MyEyeDr apart from some of the other brick and mortar stores?
Well, let me say that when you come to MyEyeDr, we're here to usher you through your vision journey, right? So we have state-of-the-art equipment for looking at the eye through pictures, retina imagery, but we also have insurance. We welcome all insurances, and I think that's really what makes our brand us. So we have insurance experts in every office. They're going to help you get the most out of your plan, your benefit. We'll file the claim for you. I truly think that's what sets us apart.
Yeah, very good. And going back to the myopia, so, is there anything that people can do to maybe slow down the progression of the nearsightedness? Is there any way to maybe kind of, prolong the need for maybe a new prescription or a prescription in the first place?
Well, so simple things are you want to try to limit your screen time to about 30-minute intervals. You'd be surprised that even just going outside allows your eyes to refocus. But there are now some specialized contact lenses on the market that have been proven to slow the progression.
Oh, wonderful.
Even though they're
Really?
specialty, it's nice to have them.
And you can get those here?
You can.
You can. Okay, very good. So if someone wants to walk in, can you just do a walk-in? Do you have to make an appointment? How does that work?
We do both. Walk-ins are welcome. Okay. Obviously, the appointment means you've got a guaranteed time slot, but we do walk-ins as well.
And it looks like you've got a really nice selection, too, of glasses. Sunglasses, eyeglasses. How many brands do you carry?
I can't answer that, but we carry enough to have every budget and every need. And again, I think that's what sets ourselves apart, too.
I
We
can
want to
see that.
accommodate to as many patients as we can.
And they're very stylish, too.
Yeah.
I like what you got. Well,
Thanks.
thank you so much,
Thank you.
Dr. Salvatore.
All right.
Really appreciate it.
Nice
All right,
spending
so
time.
come to My Eye Doctor. It's right here on Baconsbridge Road in Summerville. We'll be back after this.